Hello and welcome to All About Community. My name is Robert L. Harris. I am your host, and my guest is Dr. Jocelyn Freeman. Dr. Freeman, welcome back to All About Community. I remember when you were here a little over a year ago, we had an engaging conversation, and I believe at that time we spent a lot of time talking about COVID.
That's right.
Which has, I guess, the situation's changed somewhat. Any updates that you'd like to give us on COVID?
Well, thank you first for inviting me back. I'm Robert Bell Harris. And yes, when I first spoke, it was during the peak of COVID when we were dealing with high morbidity and mortality and death, especially in the Black community. And things are better in that respect due to the vaccine and information being shared, like through this forum, where you're making sure people get the information.
And I can't wait to get isn't there another one coming out soon?
It just got released, so it should be available at most of the pharmacies like Walgreens, Rite Aid, CVS, and through your insurance provider. But COVID's the new flu. So it's not going anywhere. People will continue to get COVID. They will experience morbidity with days of work lost and illness. And if you're at the extremes of age, the young and the older with chronic diseases, you can still have complications and die from COVID. So we still need the vaccine. We still need to wear masks if you're at risk or in crowded places where COVID is surging. So just keep your masks at all times, especially when you're in crowded places.
Good advice, and I can tell you, I will be in line to get my vaccination. Matter of fact, as soon as this program is over, you said now that it is available, I want to be the first to get mine because I believe in vaccination.
All right.
All right. I understand that you're heavily involved in a new endeavor called Mentoring in Medicine.
Mentoring in Medicine and Science actually isn't new. It's been my passion for about close to 20 years. It's a
20 years?
Yes.
Wow.
It's a nonprofit that I started about 17 years ago while I was actively working in the emergency department to address diversifying the health professions and getting more physicians and nurses and PAs, health professionals of color to address health disparities. People know about health disparities now. We talk about it more than we did 20 years ago. But one solution is to have more people who are from your community who relate to you to deliver that health care.
And how does Mentoring in Medicine accomplish that?
Mentoring in Medicine and Science accomplishes that by working with youth and young adults to give them the resources and tools they need to aspire to enter those careers. You know, even when I went to undergrad, Robert L. Harris, I knew what a doctor and nurse were, but I didn't know about a pharmacy tech or what a phlebotomist exactly did. Or a respiratory therapist. So our job is to work with local high schools and colleges.
Also, you go into high school.
We do. We do trainings in high schools where, the grab for the schools is to give them, the students, what's the return on investment. So we'll give them a certification, like in CPR or first aid, which they need, and it can help them toward graduation credit and give them a skill that is useful when they graduate. But then we slide in there where we expose them to all the different health careers. While we're doing the training, we're talking about what a respiratory therapist does or what a radiology tech does, and you only need a 2-year degree to do that. And you can potentially make 80, 90,000 plus if you enter this career.
And you start that in high school?
We do. So we have a summer internship, for example. We have about 5 different programs. Our flagship program is the summer internship, where we have students for a month in the summer. About half the students are in high school, and the rest are college or post-grad. We believe in a tiered mentorship model where our college students mentor the high school students. Our post-bac students mentor the college students, and then our residents in training or our doctors, our nurses mentor the
So college students then enter high school and work with those who are interested in medicine?
They do. During the summer internship, we train them all up, and they're in a cohort with different levels of students. So they couple together, where a college student will work directly with a high school student. and they advise them on the college application process because they're closer to it, right? I'm out
Right.
35 years, but I can still advise some of the medical students and doctors, but it makes sense for a doctor in residency training to advise a college student who aspires to go into medicine. So we primarily work with students of color, first generation students who don't have a doctor or a nurse or a pharmacist in their family. And we just immerse them in a clinical experience where they shadow with these health professionals. They can dine with these health professionals. They can network one-on-one with health professionals while gaining skills that they may need, such as suturing and splinting and ultrasound, so they can be informed of the opportunities and then make a decision.
Are there any particular criteria one has to have, especially when they started in high school?
No, we just want an interest. So you don't have to have a certain GPA. We actually have a very intentional process where some of the students have like a 2.0-ish GPA, some of the students 3.0-ish, and some of them, are academic stars. But we have found most students just need resources and they need goals to set and someone to help them with the social support that a lot of our kids that we see happening in Oakland. As an example, parents are stressed, parents are working a lot, they don't have time to sit and support the students academically.
So you provide more or less the motivation for those who have potential, but probably unrealized, but they need some motivation from somewhere, and they can get it from mentoring in medicine. We got to go to break, so don't touch that remote. We will be right back with All About Community. Again, my name is Robert L. Harris, and my guest is Dr. Jocelyn Freeman.